to Florida Statements. I'm Danielle Gavish. According to the National Association of Anorexia Nervosa and Associated Disorders, millions of college students are struggling with eating disorders. However, the majority of them get little to no medical attention to help them overcome their issues. But here at FSU, the University Health Services Center is committed to maintaining health and wellness for the campus community. Here to speak with us today about eating disorders and the help available to fight them is Nutritionist of the FSU Health Promotions Department, Heather Fisher. Welcome.
Welcome, thank you.
So what are some of the statistics having to do with college students and eating disorders?
Well, recently we did a Healthy Bodies survey at FSU.
Okay.
FSU student specific, about 900 students participated. The prevalence of a positive screen for eating disorder was 4%. Sounds kind of low, but there's individuals that do engage in behaviors that can ultimately lead to positive screen for an eating disorder. So it's not just anorexia, bulimia, pure sort of diagnosis, but there's many out there that are not coming forward because of shame or embarrassment or that. So it sounds like a small percentage. Of that percentage, the primary one that kind of rose to the surface was binge eating, followed by purging, and then restraint, so dietary restraint.
What are some of the myths associated with eating disorders that you think should be dispelled?
Eating disorders are not only for women. Eating disorders occur across gender, ethnicity, so cultural ideals of beauty and muscularity, and that can impact all people.
And what are some of the factors that being a college student can take a toll on having an eating disorder compared to regular normal people?
Right. Well, I think it impacts all people, but in terms of what impacts our body image, negative body image, body dissatisfaction is a primary risk for eating disorders. So at college, we do quite a bit of comparison. We're talking quite a bit about who's following what diet. We're talking about good food, bad food. And this leads to quite a bit of confusion and a hyper focus on one's own body and a strong desire to change it, just kind of culturally.
So tell us some of the services available on campus for students that may be suffering with an eating disorder.
Excellent. So at Florida State, we have a very strong team, eating disorder treatment team that includes the dietitian, myself, our medical director is involved in our treatment team, psychiatry, advanced nurse practitioners that are specialized, all of us are specialized in eating disorder treatment. And we meet together and discuss student cases so we can provide the best care for the students.
If someone has a friend or knows someone that they believe is suffering from an eating disorder, what's the best way for them to approach it?
In these situations, they're very sensitive, so it would be a close friend that would approach the person in a private setting and not be like attacking the behavior or say, you know what, I heard you vomiting in the bathroom, but kind of approaching it as, I'm concerned, I want to let you know that I'm here for you. Is there something that I can help you with? Eating disorder behaviors are often related to managing or coping with negative emotions as well, and not really, like it's not just you're attacking the behavior, it's not just I'm trying to lose weight and using this. Eating disorders are a mental health concern. So just being sensitive, non-judgmental, not falling into that, oh, you say you're heavy, but you're actually thin. So you're not talking about the body stuff. You're just saying, you know what, I really care about you. You can come talk to me anytime. Students have come and have had consultations with me so I can better direct them to their individual situation. So students can come talk to me about their specific situation with their friend.
And what are some success stories that you have with dealing with students that have dealt with an eating disorder and now don't?
Eating disorders across a spectrum. The longer that you are in that situation, the harder it is to disengage from the behavior. But I have had success of students going from our university. We tell them, we cannot manage your situation here. You need to go to an inpatient treatment facility. I've had a few students come out of that experience and be stronger for it. And then we just manage their positive behaviors and really reinforce and prevent relapse and promote recovery. So we do have examples of that.
And if someone, if you see a sign, but it's not necessarily like you hear someone purging or you see them not eating, what are some of the other signs that you can look out for friends who maybe seem increasingly thin?
Individuals tend to start talking about food a lot, and they're evaluating their food a lot. They're like, I can't eat that because it's bad, it's junk. Or they say, oh, I haven't eaten all day. Like they're proud of it. That sort of thing. So they're talking about that, or they're making lots of negative comments about their body. They're not going out with their friends because of their dislike of their body, and they feel like, I just don't look well enough in
all right, well,
comparison.
Thank you so much for all that information.
Thank you. Sorry.
A campus community that is transformed by innovative health policy practices is the Vision of Health Service Center. For more information on what health services are available for you, make sure to visit healthcenter.fsu.edu. That's it for this Florida Statement segment. You could see other interviews throughout the week on 4FSU. Remember, if you're 4FSU, then you're watching Comcast Channel 4. I'm Danielle Gavish. Thanks for watching.